السلام عليكم أصدقائي. اليوم راح نسوي محادثة مع دكتور راجيف من مستشفى مانيبال، دكتور العظام. Hi sir, how are you?
Hello, good.
Hi.
Assalamu alaikum.
وعليكم السلام. Good morning.
Morning.
Sir, please introduce yourself
Okay.
for the people.
Thanks for inviting me to give a talk to Iraqi YouTube channel. Thanks a lot to my friend. I am Dr. Rajiv Verma. I am an orthopedic surgeon who specializes in joint replacement and especially sports injuries. And I work at Manipal Hospital, Dwarka. I am the head of the department, and with me in my team are different surgeons who cater to the upper limb surgery, especially shoulder, elbow, any complex injuries, any trauma. Also, they do laparoscopic surgery or an arthroscopic surgery for the shoulder joint for sports injuries, like you get in any football players, hockey players or tennis players, especially overhead sports. And I have also Dr. Lalit in my team who specializes in complex trauma and foot and ankle problems, which is very common in Iraq also and in our countries also, where we walk barefoot. We have spinal surgeon as well as pediatric orthopedic team. There are a lot of patients which I have seen back in Gurgaon Fortis and in Manipal who kids have a lot of complex genetic problems. So Dr. Manoj Padman's team is here to deal with them. This is my team, and also we have in our team the best physiotherapist and rehab specialists who can get you up and about on your feet within few days after the surgery. And in most of our joint replacements, we make you walk the next day. We have got a good anesthetic team as well. Apart from that, we'll show you our, Ahmed will show you our OT complex and everything, our hospital environment. So it is one of the state-of-the-art hospitals. So you can be rest assured that when you send your patients or you come here for treatment, then they'll get the best care possible, comfortable. Yes.
So sir, now let's talk about the main or famous problems for, as example, Iraqi people about knee replacement.
Yes.
I think this is main problem.
Yes. Yes, lot of, as Mr. Ahmed has rightly pointed out, lot of Iraqi patients, and actually all the patients in Middle East, in Asia, have knee problems. Similarly, when I was in UK and USA, where I was for 9 to 10 years, most of them had hip problems. So that is the difference. So if I used to do 10 hip replacements in UK, USA, knee replacements were 4 or 5. In India and in Middle East and Iraqi patients, it's 8 knee replacements out of 10 and maybe 1 or 2 hip replacements. So yes, you are absolutely right. The knee problem is the most common. And other thing is a lot of people are playing sports, football, you get a lot of ligament injuries. Yes. So that is also the knee problem.
So sir, about knee replacement.
Yes.
I think there is full totally change and half change.
Yes. Yes, this is the recent thing which is available. So if I show you the knee model, so knee has got 3 parts, or basically we call as 3 compartments. One is medial compartment of the knee, so this is the medial gadroof and lateral compartment, and one is behind the knee cap. So this is the patellofemoral compartment. In total knee replacement, we replace all the parts, this part, this part, this part, as well as patellar part. So if I show you the model of the knee replacement, can you see this? If you see this, we changed this part, just shave it. This is like a plastic gadroof, and we change the patella also sometimes in the behind the kneecap. So this is full knee replacement. And partial knee replacement is when they have got a degenerative or arthritis only in this part. So basically medial part, then we just change half of this part and half of this part. So now the question is, if Mr. Ahmed has asked me, why is it important to know, do we need to do half or full knee replacement? In half knee replacement, patient can walk even without support after 3-4 hours of the surgery. Yes, that's the difference. And they can actually bend down, and even if they can sit down on the floor to read namaz also in half knee replacement. That is the difference. In total knee replacement, we tell them to avoid it.
Okay.
And rehabilitation is long.
Nice, nice. And now, sir, we talk about types of knee replacement.
Yes.
Because many people don't know what's the good one, which one is lower quality, which one is good quality.
Yes. Okay, that is also very relevant for your patient. We here, and when I was in UK, USA, I used to use the standard implants, which is like American made and UK made, mainly American made, like Zimmer, Smith and Nephew and Stryker. The reason I use them, and they are expensive also, is because they have been time tested. So those knees have been in business for almost 30 years.
Okay.
So we started in late 60s and early 70s knee replacement in USA. So we have got the results of 30 years. So I would like to implant those knees in your family member or your patient, so they can have long-term good results.
Okay, these best
knee replacements, yes.
Okay. Sir, another question about knee replacement patients. After how many days they can walk in hospital, and after how long time they can walk normally?
Yes, that is also very important. For that, you have to have a very good physiotherapy setup like we have.
Okay.
So normally, when I do my knee operation, then we ask them to start exercise the same evening. Okay. Lifting the leg up,
same
moving
day.
Same day. And if some patient who is young and we do half knee replacement, then we make them walk in the same evening. They can walk the same evening, no problem.
Nice.
But most of the patients who are old, 60, 65, 70, those old ladies who have not walked for many days or weeks, we make them walk next day with support, obviously.
Okay.
So I always tell that next 2 to 4 weeks they should use a walker frame. If both knees are done, then they can come on a stick, walk with the help of a stick, and normally at 6 weeks they can even give up the stick. So you can say 6 weeks to 8 weeks they should be walking normally.
Okay. Let's talk about physiotherapy, because it's, I think, important part, how it's effect on the surgery.
Yes, this is actually excellent question, because these patients who come from their home, from Iraq, Uzbekistan, anywhere of part of the world or Africa, so what they want is they come here, they want to do the surgery and go away. That is not a very good idea. I always tell, and I think even Ahmed tells his patient, they need to stay for 2-3 weeks.
Yes.
Because once they go back home, they don't do exercise, then the knee can become stiff. So sometimes the patients come after 6 months, doctor, I have got the surgery done, there is no pain, but I cannot move my knee. So it is very important that they do physiotherapy. Even if they have to go urgently to Iraq or their home country, then they should actually get in touch with a very good physiotherapist there. So they can help them move it. And if they cannot move it, or if they find it difficult because they have got the arthritis for years, then we have got a special machine, what we call as a continuous passive motion machine, which can help them move the knee. So machine is sort of one limb goes here, one goes here. So it moves the knee through full range. The machine helps without them using their strength. So we have got all the different instruments and things so that we can get the knee moving.
Sir, because sometimes patients do surgery and at home they not do physiotherapy. After this they say, I feel pain.
If you don't get movement and if you don't do exercise, you will get pain.
Same problem. Now let's talk about hip replacement.
Yes.
Sir, hip replacement, I think it's more difficult surgery compared to knee replacement.
I would not say it is more difficult for a surgeon. It is, if you are trained in doing hip replacement and knee replacement,
the patients, maybe.
It is not that difficult. Yes, for the patients, the cut is sometimes bigger, and because there are a lot of muscles in the hip area, sometimes they find it is difficult. But there are approaches, like I do through a posterior approach, so I don't cut any muscle.
Nice.
So we can actually do it hip very nicely, which I was trained in UK to do. And we don't cut, we suture back all the muscles, whatever tendons we cut, and they have got almost a normal walk and normal result. So I would not say it is very difficult. If you are well trained, then it's not a problem.
Yeah, of course. You have big experience.
Yes, yes.
So, sir, about knee replacement, we understand.
Yes.
Now about hip replacement.
Yeah.
How many types they have, or I hear there is ceramic.
Yes, very good, very good. So hip replacement is different types. In knee replacement, mainly we have got a cemented knee replacement. There are uncemented, but not very common.
Okay.
But in hip replacement, there are different types, and most common two types are cemented and uncemented hip replacement. Other good question which has been asked to me is different types of bearings or types of head. Like we have got a metal head, and this is a ceramic head, which is the newest addition. So if you see this ceramic head is very shiny, smooth, yes, and it is actually very strong as well, and it causes less friction with the polyethylene or the plastic bit. So it actually lasts more years. So it can even last up to 30, 35, 40 years, they say in the lab.
Okay.
It lasts. But the metal part, because it is a bit more rough than the ceramic, so it causes more friction. So it lasts less time.
Okay.
That is the main difference in ceramic and metal.
Okay.
Because this bit is the same, this bit is the plastic same. It depends on the friction with the metal or ceramic.
So, sir, this also American?
This is all American implant. It is
Okay.
mainly striker.
Nice. Sir, there is, most of the patients who come here, they do hip or knee replacement. They are fat, and they always ask.
Yes.
Maybe I have problem. Maybe what should I do? Maybe it's not fit for me, the surgery, because my weight. So what's your experience?
Yes. My experience in that is, even if the patients are big or fat, we should not deny them surgery. Because if we don't do surgery, they will not be able to walk or do exercise. Okay. And as far as the fitment of the implant is concerned, I can assure you, the patients from Iraq or from the Middle East, they are as big, or they are not actually that bigger than the American and UK patients, or UK or European patients. So those implants are actually more suited for European, UK patients, because they were made there, and Iraqi patients. They are actually bigger for Indian small Asian population, but they are actually good fitment for Iraqi patients. So that's not a problem. And as far as it is concerned that I am big, my weight is more, will the implant last? They are designed to last, and as I said that even in UK, USA, we used to do this replacement for 100 plus kgs commonly patients. So they last in them, so why not in big Iraqi patients? There is no problem. Different companies have different sizes. Sometimes they have 1 to 7, 8 number implants. Some companies have A to E or F implants. So there are different companies have different sizes.
Many patients come and they have different problems, or they take different medicine.
Yes.
Which medicine they can stop or continue, which is effect on the surgery, as example.
Yes.
Is there any?
Yes, lot of these patients who come for joint replacement, they have got other problems like diabetes, blood pressure, thyroid. So I would advise it should be well controlled. Even they are taking medicines, then see their doctor in their country and get it well controlled. But the only advice is, if they have to stop a medicine, then they have to stop the blood thinning tablets like clopidogrel. Okay, so they have to stop it 5 days before the surgery. So either once they come, they should talk to their doctor, or their doctor in India, so we can guide them which medicines to stop.
Sir, another question about, especially about Iraqi patients.
Yes.
Most of them have diabetic.
Yes.
Okay, and they are old also. So is it possible to do these surgeries for diabetic patients,
Yes, most of the patients who are old and they have joint replacement, they actually have other problem also like diabetes and blood pressure.
Yes.
It is perfectly fine to do it in those patients. The only thing is they should not have any infection like foot infection, toe infection before the surgery, and also their surgery sugar should be well controlled.
Okay.
So if it is not controlled, then they have to wait here. We have to control it
You have
and
to
then do
control.
the surgery.
Okay, but it's possible.
It's
by
possible
you can
to do it.
control
We can
by other
medicines, injections, and then do surgery. Yes.
Okay.
Yes.
Okay, and you are ortho doctor.
Yes.
So how you can manage this?
Yes, that is very important. That's why all these joint replacements and these surgeries, complex surgery, should be done in a big setup, like in a big multi-speciality hospital. The reason is because we have got a full-time cardiologist who look after your heart. We have got full-time endocrinologists who look after your diabetes. We have got physician who look after your blood pressure and other problems. We have got anesthetic team who will check your pre-anesthetic checkup. So everybody is available here, and even if you have had any cancer in the past, we have got cancer specialists who can tell you what medicine to take and what to stop during surgery. Even the cardiologist will guide you. They will do your echo, ECG and give you fitness.
Okay, sir. Thank you so much for these main and important informations for the patients. Dr. Rajiv Verma from Mannipal Hospital. We say thank you so much
Thank
from
you
our
very much.
channel. Okay, and we hope that
Thank you. Thanks a lot for listening. Thank you. And thank you to Mr. Ahmed. Thank you.
Bye.
Thank you. Bye-bye. Bye-bye.